Hello, welcome to another episode of Coffee Talk with Encore. Today we'll be discussing patient behaviors and the importance of behavioral health. Well, as clinicians, there is a lot we can do to minimize the potential for unintended behaviors in our patients. And for starters, we can strive to find out all we can about our patients' backgrounds and their experiences.
Yeah, Kathy, I think it's really important that we do a deep dive into our patient's medical history. When we're looking to prevent those behaviors, we need to understand what's causing them. And so we're going to be looking for diagnosis that might indicate that there's a potential for behaviors. So if we're seeing that PTSD, if we're seeing any of our psychological disorders, our dementia diagnosis, and sometimes even our cancer diagnosis, then we're going to be kind of alert and aware that there's the potential for behaviors. We also need to take a really close look at medications. There are some medications that they're really beneficial for our patients and they might be medically necessary, but they are tied to behaviors. And it's not universal. Certainly there are medications that are tied to behaviors in women. There are medications that are tied to behaviors in men. Sometimes they're at the onset of a medication, sometimes when they're removing a medication, and sometimes it's the entire time the patient's on that medication. So you just need to work with the medical team, think about what's been going on with your patient, and kind of be aware of what's in that chart.
Definitely. Those are all really great points, Becky. So I always try to tell other therapists that I work with that we as therapists should be thinking about what's causing the behavior and think of that behavior. And I always kind of say behavior because when we use that word behavior, it's not necessarily that they're acting out and trying to be negative, but we need to think of that as they're trying to express something, to express that they're having a need that's hasn't been met. So especially with those patients with history of dementia, or if they have a decreased ability to communicate, they're trying to communicate something. So frustration, if they're in pain and they maybe just don't know how to tell us that, if they have even just the feeling of being wet or uncomfortable, if they're overtired. So the underlying causes for these, quote unquote behaviors just, go on and on. So as Becky mentioned, having a good picture of your patient's background and medical history, if they have any specific traumas or experiences that make certain things that we do in their everyday care plans, difficult or stressful. I'll never forget, as a new speech therapist, I had a patient with a diagnosis of dementia, and I came to realize that on occasion, it was actually my approach that would set him off to be angry and kind of shut down in our session. So it really made me kind of reevaluate my approaches and learn more about these behaviors, those unmet needs, and then dementia, and just adapting my techniques as a clinician.
I love, Ashley, that you touched on the unmet need, because I think I shout that from the rooftops. Like there's something that we're missing. There is something going on that is causing this behavior with our patients. So it is our job as therapists, we're really skilled at this, to take time to figure out and identify those triggers, figure out what's going on, why they're having the behavior. And then once we figure out what's triggering the behavior, then trying to solve the problem. So we can do that through therapeutic trials of, sensory stimulation. Maybe it's movement. I see people a lot of times in skilled nursing facilities, patients stand up. And what do? We don't want them to fall. So we immediately go over and set them back down. Well, maybe they just need to go for a walk, right? Maybe they need to stretch their joints, stretch their muscles, and just go for a quick walk before they sit back down. So we are really skilled at that. So that's something that as therapists, we should be doing to just kind of figure out what we can do to solve the problem. A big one is also environmental modification. How can we modify the environment? Is there too much external stimulation and this person is feeling overwhelmed? So once we figure out what the unmet needs are, what therapeutic approaches are beneficial for this patient, it's then time to educate the caregivers. So nurse aides, nurses, floor staff, whatever it may be. It's also important that we are not just educating day shift. There's, a lot more staff in the facility. So make sure that we're also hitting afternoons. If we're not there on the midnight shift, even just leaving a sign-in sheet saying, this is what we have discussed about this patient. This is what we're finding is beneficial, having them sign off on it. Just something to show that, we did figure this out and this is what's going to benefit our patient.
Kelly, while you're talking about the topic of, education, I couldn't help but have the idea of the fact that our patients, our residents, they don't necessarily know the ins and outs, the processes, the systems that go on within any kind of healthcare environment. So they're just confused. At the end of the day, they've never experienced this before. So what's just easy for us, it's a part of our day. This is the system. This is the process. We know what time people get up. We know what time lunch is. We know what to expect and what to anticipate, but they don't. So they've kind of lost that independence and that ability to go about their day based on their own schedule and their own timeline, in essence. So I think that some of this is that what we may see as behaviors, in a sense, is really just, like Ashley said, they're just trying to communicate and express their frustrations or their concerns or whatnot. So I do think that we need to kind of take that into account as well, that they don't know the ins and outs of the building and the daily operations like we do. So certainly something to be aware of. We've discussed today that there are a lot of things that clinicians can do to, help our patients. We can help to get to know our patients. We can look through, their medical record or ask them or look for these symptoms that are related to behaviors and behavioral health. And like Kelly said, we can educate those caregivers on how to successfully engage with patients. Working together, we absolutely can make a difference in lessening these unwanted behaviors while at the same time improving our patients' quality of life as well as their interaction with others. Well, I would like to thank everyone for joining us today and listening in to hear our discussion on behaviors with regard to behavioral health. And we'll look forward to having everyone tune in again for our next episode of Coffee Talk with Encore.